Manual therapies like physiotherapy, fascial stretch therapy, osteopathy, and we could make mention of other things, but we want to make particular mention of yoga. They're often seen as a bit airy or unspecific in their effects. But there are really some very simple reasons as to why they can be beneficial to the body's health and structural integrity in a big way. In a previous video, we talked about how manual therapies can reduce total body stress through mechanical means and help to regulate our fight or flight response and are overall healthier because of that. In this video, we actually want to talk about the fluid joints of the body, the synovial and the intervertebral discs, to name a few, and how manual therapies, fascial, tissue-based therapies, hands-on therapies can actually do a lot to maintain that fluid in the proper amounts at the right times. As just a basic primer, we want to say that proper fluid production in joints is determined in a large way by varying movement. And it's not the only thing that helps regulate that, but it is a big one. And so it should be considered as such. We're going to start out with our two major examples. We have a synovial joint. In this case, we're looking at the knee. And the knee is one example of a synovial joint. We could certainly look at the hip, or we could look at the ankle, or any of these tiny bones of the foot, or, elbow, shoulder, and those joints, anything with fluid in it. And what's true of pretty much all synovial joints is it will have a capsule around it to contain a certain amount of fluid in there. Otherwise, it would just escape out, and that would be obviously very bad. That fluid's there for a reason. It's an excellent buffer. Now, this is true of synovial joints, but it's actually also true of what we call an intervertebral disc. There'll be a capsule and there'll be a fluid on the inside. Now, in the case of the intervertebral disc, it's actually called an annulus fibrosus, the outer side, and a nucleus pulses. Now, it's totally surrounded. Both capsules, whether synovial joint or disc, are totally surrounded, and multi-directional fibers are there to contain this fluid and balance motion in this area. We're just going to leave that out. Just understand that it's there. We're just going to leave it out for the purpose of this discussion. So we've got these two joints. Now there's something that produces this fluid, because it's not just there stationary all the time. In fact, it's cycling through. Everything has to flow in the body, otherwise it's stagnant, and it's prone to infection, which is dangerous. The only thing that really stays still in the body is very dangerous. So we need to encapsulate it to keep it there from spilling out too fast. But at the same time, we need to circulate it through. That means it's produced and it's released. In the case of the synovial joint, there is a blood supply to the area. So there'll be an artery, and off that artery will come capillaries, and not to get too technical, but the capillaries will allow the fluid of the blood, what we call a plasma, to enter into this space and become that fluid. They'll allow it through small openings that we call fenestrations, and it simply sort of spills out in a regulated way, but it does spill out. Another thing that we actually have is something we call hyaluronic acid, HA, in the area, and that is as well produced by something we call the synovial membrane. And so it's something that actually maintains the water, because it has a charge, and water is attracted to a charge. So it's needed. This hyaluronic acid keeps it at a certain rate and a certain speed. Now, what's interesting is both the flow of the fluid into the space, both that fluid getting in to that joint space, and the production of hyaluronic acid is partially controlled by movement in the area. There are studies on this fact, and they're done on rabbits, and that's pretty close. And this means that they've determined that the movement in the area is not the sole contributor to fluid being in the space in this area, but it is one of the major contributors, in that we get less hyaluronic acid, less fluid in that space. And we do need that fluid. It's very important that it's there. Now, with the intervertebral disc, it is slightly different. Not drastically different, but slightly different. It, too, will have a producing area for the fluid that we call the Nucleus Pulses. Now it's on the cartilaginous end plates. And instead of being sucked in by hyaluronic acid, it is allowed to diffuse, simply pass into the area. And this, of course, would be happening in all of these disc space, but we're just going to draw the one. It's allowed to diffuse into this space by the cartilaginous end plates. Now, what happens with the human body and these discs is that during the day, as we're standing vertically, the compression, the compressive force of gravity and the weight of our body actually makes it so that that fluid gradually seeps back out of the area. And this is normal. We actually lose height through the day. We want this in a way. It's normal. It's predestined. We're all going to do it, and that's okay. The thing is, though, as we sleep, as we become more vertical orientation, we have the capacity to change the way gravity is hitting us. So now gravity is pressing down like that and not down like that. So what happens is this adds to a separational force. And so the lumbar spine, the disc area right here that we've drawn in that previous picture as well, essentially becomes locally decompressed by getting pushed on by gravity in a different angle. And so when this is the case, when we actually reverse the effects of gravity, or at least change them, this allows the influx of fluid back into that intervertebral space. And so this is achieved. So now it's not commonly said, but you do have to understand if this is a normal thing, then much like the synovial joint here, much like the fact that it moves backwards, forwards, left and right, and it's doing all that, it stimulates fluid flow, it stimulates hyaluronic acid production. As well, when the vertebra moves, when that vertebra moves it through flexion and extension and side bending and rotation and all that stuff, it is moving it at the vertebra as well. And so this too adds to some of the daily influx of fluid throughout the day. It's not as good as sleeping. Sleep is really important for that reason and others, but it is just as valuable. It's very much the same thing. So the production of that fluid, the way that the decompression of the vertebra or the movement through ranges of motion in that joint, in the synovial joint or the cartilaginous joint of the intervertebral disc, it is incredibly important that that movement makes sure the fluid stays there. Now here's the thing. When we start to lose that fluid, it gets to be a real problem. Consider for a second what happens when we start to get too close. These joints, and there are a number of them, of course, again, ankle, knee, hip. When these joints start to come too close together, when the fluid space is eliminated for whatever reason, we start to get a bone-on-bone effect. It starts to be that the cartilage that was once there actually gets ground away, it gets destroyed, and we can in fact grind the bone so much that the joints will fuse. This is an extreme case, and of course nowadays we have modern technology so that we have hip and knee replacements, shoulder replacements, and all kinds of different surgeries for that. But it's detrimental. That fluid is there for a reason. In the case of the intervertebral disc, when we really lose fluid, we start to get a flattened, very thin disc, and we call that degenerative disc disease. Again, it is just as bad, and when it starts being bone on bone, this is a problem. This will often cause destruction of the joint, complete lack of mobility, of course, but because how could any joint move when this is a situation? And so it adds to the wearing away of the surface. This could happen at a young age and a premature age. And we just want to mention something that we think is a factor in all this. Again, if movement, if position changes the fluid influx into the joint, vertebral or synovial joint, that means the wrong kind of movement can make it happen sooner, and the right kind of movement may be able to help or prevent or maybe even reverse some of the potential destruction. So we're going to give just a real simple example. Let's take for a second, we're looking at any joint from a superior view. That's just an above view, not the best view. So let's say we've got four areas of just, we'll say muscle. front, back, and sides. And that could really be anything. In the case of the lumbar spine, of course, we have like a psoas muscle that looks nothing like that. We have a QL for the sides and a rector for the back. And then, of course, in the knee, which is our example here, we could have, say, the quadriceps, which do go all the way down. We could have adductors on one side, hamstrings in purple on the other, and then, of course, we've got gastrocs in orange here, just to name a few. But understand that most joints will have circumferential muscles. They'll have muscles going all the way around. And so in this very simple example, that's what we've essentially shown here. So there's muscles going all the way around. And then, more often than not, there'll be fascias. And you could call those whatever you want. You could call them the banding around the muscles. It could be the planar sheets. It could be ligaments and tendons. But any joint, and there'll be two bones in that joint, any joint is surrounded by a soft tissue. Consider for a second, let's ignore the fact that we're understanding fascia has a contract element. Consider for a second that these muscles here started all pulling simultaneously, all starting to pull down on that joint, essentially approximating the two surfaces together, contracting towards one another. As that happens, the joint is compressed. And as that happens, the fluid space tends to be compressed, that braces between the bones. Again, for intervertebral disc or synovial joint. And it wants to push out. It's got that buffer. It's got that buffer around it, what we call either the annulus fibrosus or the synovial capsule. It's got that buffer to prevent the escape, but it doesn't mean that it will stay there forever. Recall that gradually over time with pressure, synovial fluid tends to escape, as well as does the intervertebral disc fluid, the Nucleus Pulses. And so with sustained pressure over a long time, we get less and less and less of that fluid. And we're not talking about instantaneously. We are talking about over a long period of time. This could be months, this could be years, depending on pressure. But overall, because it's harder to get fluid in, it's harder to recover fluid. That fluid is generally lost at a rate higher than it's produced. And so this is something we have together. Ultimately, the joint ends up approximating. It ends up pushing together in a significant way, and we start to lose that joint height. This is one possibility of how that might happen. And so it's not so much about how it's pressurized in a second. It's about how it's maintained over a long period of time. If that fascia, the fascia that coats all around that joint, that basically covers it like this, it covers every joint really, because those fascias are everywhere in the body. If those fascias are left in this shortened state, this shortened and compressed state, where everything is tight around them from all four sides, that joint can never be released. And so it's needed. Manual therapy is needed. Again, whatever that happens to be, physiotherapy, osteopathy, fascial stretch therapy, yoga, and many other practices. It's needed to help release the tension, the pressurization of those joints through that connective tissue work. Just want to say, just to finish this off, loading the joint is not a bad thing. We didn't want to imply that. In fact, it's a very necessary thing for proper bone maintenance. You need to load your body with weight to build muscle and maintain muscle. And so that's not bad. It's when the body is loaded and compressed and held in that state for too long a period of time. That's when it gets to be a problem. And so these fascias, these connective tissues, being too dense and compressing on those joints can add to that significantly. This has been Elge from Simple Lines Anatomy. I hope that made sense.